name is Taylor. I did my internship at the Children's Hospital of Philadelphia in their nephrology department. So a little bit about the Children's Hospital of Philadelphia. CHOP was the first hospital in the nation that was exclusively devoted to children's health care. Their goal is to provide families with the most advanced care available. And on their webpage, you can find this quote. It says, "Built on the foundation of delivering safe, high-quality, family-centered care, the hospital has fostered medical discoveries and innovations that have improved pediatric healthcare and saved countless children's lives." The structure of CHOP is that it is made up of a bunch of different facilities. There is the main campus, which consists of all the healthcare specialties you can find in one building. They have primary care, they perform surgeries on the main campus, and they have a newborn and pediatric inpatient unit. CHOP also partners with multiple hospitals in the area, and they employ their own employees there so that they can have a connection. There are also multiple urgent care facilities throughout Philadelphia for CHOP, and they offer home health care. So CHOP receives its funding at the state and federal level from Pennsylvania and New Jersey. For their research, they get funded by grant funds, and this past year they received about $360 million in research grants. Since CHOP is a charitable nonprofit hospital, it depends on philanthropy to advance its mission. So they have a Children's Hospital of Philadelphia Foundation where people can donate money to, and it will help cover medical costs for families who cannot afford it. So this relies on generous families, individuals, companies, and different foundations to make significant contributions to keep this foundation going. And this past year, they raised $100 million in gifts and pledges for the foundation. The population served at CHOP, so since CHOP is one of the safety net hospitals, they do serve a disproportionate amount of the state's low-income and medically vulnerable children. They're also a hub for international patients. The doctor I was working with, Dr. Myers, was the contact for the United Arabs patients. And then a large majority of the patients who come to receive care at CHOP are from Pennsylvania and New Jersey, but people travel from all over the U.S. to receive care. The types of professionals you can find at CHOP, there are many different kinds. You can find the traditional types of professions like doctors, nurses, PAs, nurse practitioners, but you can also find some that you can't find at all facilities, like social workers, speech therapists, physical therapists, occupational therapists, dietitians, translators, diversity and inclusion coordinators, refugee health programs, vaccine educators, and pathology and laboratory specialists. So it's kind of just like a one-stop shop for everything you have to do. You don't have to go travel around to different buildings. So my research responsibilities were mostly just to shadow Dr. Myers and a lot of his colleagues. He worked with about 6 other doctors. There's 1 PA, 2 nurse practitioners, a couple dietitians, social workers, and fellowship students. So I got to follow most of them around. I also worked with Dr. Myers and Dr. Amaril's research teams to learn about their different research projects. Just Dr. Myers' research project was more a clinical drug study, while Dr. Amaril's was a behavioral study. Also, every day at lunch, I would attend meetings that covered different topics, like inpatient and outpatient reviews, so just like reviewing their charts, and dialysis and patient and transplant patient care. I also got to attend one of the meetings where the graduating fellows presented the project that they had been working on for the past 3 years that'll get implemented in the nephrology department at CHOP. So for my internship project, I developed 3 handouts for the nephrology department to potentially give to patients and their families. The first handout dealt with the benefits of exercise for CKD patients. So whenever CKD patients get diagnosed, they usually feel like they're fragile, so they decide not to exercise anymore. But it's usually a good idea for them to start exercising because it can actually help their kidney function. So included on my handout is the benefits to exercise for CKD patients and the different types of exercises that are safe for CKD patients. So usually low impact sports are what they should be doing. On the second handout, talked about the beneficial diets for CKD patients. So diet's really important for these patients because since your kidney filters everything, you don't want high amounts of like salts or anything being filtered through there, because once your kidney stops working, it'll just build up in your body. So I included the Mediterranean diet and the vegetarian diet, the importance of healthy diets for CKD patients, and a list of healthy snack ideas for parents. The third handout talked about depression and anxiety in chronic kidney disease patients, which I found is overlooked a lot because people mostly focus on just the disease itself and not what it's doing to the patient's mental health. So I included signs of depression and anxiety, why depression and anxiety occur in CKD patients, and how to help. And for all three of these handouts, I had to make sure that they were written at an 8th grade reading level or below, because a lot of people won't understand clinical writing, and you want everyone to make sure that they can implement these tips into their lives. And these are just the images of the 3 handouts I included. So this one is the exercise, this one is diet, and this one is depression and anxiety. The public health domains and competencies that I was involved with at my internship were the science of human health and diseases, health promotion, socioeconomic impact on human health and health disparities, behavioral factors impact on human health and health disparities, and environmental factors impact on human health and health disparities. The most important learning experiences for me were that since I do want to go to medical school, it was really important for me to learn about the reality of what it's like to become a doctor. So some examples were working long hours, dealing with insurance companies, the amount of student debt you have when you come out, and malpractice insurance. And it was also really important for me to see how the doctors interact with patients in good ways to help people who don't exactly work in the healthcare field understand their health and how they can take the measures to stay healthy or to get better. So what I liked most about my internship was being able to interact with patients and seeing firsthand how big of a role all the doctors I worked with played in their patients' lives. My least favorite part of the internship was the week where I was working with his research team. While now I understand how much effort goes into getting a research project up off the ground and running, I just realized that I do not want to have a career in research. My most memorable experience from my internship was when I got to meet a patient and his family who he would be having his kidney transplanted the next week. There are plenty of kids I met that were still waiting for a transplant or weren't quite there yet to need a transplant, but this was the one family that I met who it was becoming a reality for. And meeting them just put into perspective the amount of time it took for them to receive the transplant and how long the process takes to get to that point. And it also just showed me how much it meant to the family because of how much stuff they had to do prior before getting the transplant. And these are my references.